Today in the United States, drug overdoses are the most common cause of accidental death. These overdoses are even more common than a car accident. The number of these deaths has doubled in the last decade. You may know someone who takes prescription opioids, OxyContin or heroin or a similar drug. Very often they overdose beyond the reach of a nurse or a doctor. As a result, we have a national crisis that impacts the public health, the social and the economic welfare of many people. You can help someone who's having an opioid overdose, even if you don't have specialized medical training.
Opioids are medicines for pain. Vicodin, Norco, codeine, OxyContin, Percocet, Opana, methadone, and fentanyl. Heroin is also an opioid. No use of illegal opioids is safe. But knowing these common risk factors could help reduce harm and potentially prevent an overdose. Avoid mixing drugs. Using any opioid such as heroin, hydrocodone, methadone with alcohol, benzodiazepines, or any medication that can make you sleepy increases the risk for overdose. Avoid unfamiliar suppliers or changes in quality. If you use a new dealer, or your dealer gets a new supply, it may be of a different strength than what your body is used to. It may also be cut or mixed with other drugs. Go low and go slow, trying a test dose first. Avoid having someone else inject you. If you are relying on someone else to inject you, then they are in control of your dose. This is often a problem for women who may have their partners inject them. Avoid taking more than you are used to, especially after a period of not using opioids. If you have been opioid-free for even a few days and then take opioids again, whether pills prescribed by a doctor or illegal drugs like heroin, you are more likely to overdose. Avoid using alone. Always use with a partner and educate them on responding to an overdose. If you do use alone, notify a close contact of planned use and either stay in contact as you use or have them call 911 if they don't hear from you within 5 minutes after injecting, or within 10 to 30 minutes after snorting, smoking, or swallowing your opioid. In the following videos, we will cover information regarding how to recognize the signs, common myths, and proper steps in responding to an opioid overdose using naloxone, commonly known as Narcan. This training could mean the difference in you playing a life-saving role and potentially preventing an opioid overdose death.